Here we are in week 10 of our transformation journey together. We spent the majority of the first portion of the course looking at the model for sustained transformation. And in the past several weeks, we've been now looking at the evidence-based practice model of Melnick in a bit more detail and demonstrating the way that Melnick's model can be used as a systematic process within the model for sustained transformation. And we began to discuss how understanding existing evidence and literature can help us to form a vision for the better future state that we would like to create through our DNP projects. So this week we're going to focus on the background literature and understanding how existing research can inform what we do in our DNP projects. We've said that the Melnick's step one, the first part of the process, is to cultivate a spirit of inquiry, asking how can things be better for our patients, for our process, for our populations, for our policies. And once we have that spirit institutionally of asking how can things be better, then we need to be very structured and very focused in how we frame our question. And we talked last time about using the PICO format as well as the problem statement format as two different but complementary tools for framing a problem. So we're doing the problem statements, we're doing the PICO questions because a prudent question is one half of wisdom, according to Bacon. It's defining the problem well so that we can answer it well. And we demonstrated this using a PICO question related to HIV medication adherence at an East African HIV center, a model of excellence. We showed how a weak problem statement got very little traction in helping us to go engage in the 7 steps of the systematic transformation process, but narrowly defining the issue allowed us to go much further. And so let's talk a little bit about how obtaining evidence, existing evidence, can be a strategic step in this model for sustained transformation. So we've seen that evidence in the scholarly community, what's been published and disseminated and written about, can be used in our context to customize that evidence to fit our needs. And that's the third step in the systematic process of change. So by identifying what others have written about and then customizing it to fit our setting, we're engaging both the systematic process of the model for sustained transformation and the systematic process of evidence-based practice. But getting excellent research evidence to support our change doesn't only relate to the customization step. It also helps to give us vision for the better future state. When we see what others have published from similar contexts as ours, we can see what some benchmarks are. If we're outperforming our colleagues in certain clinical processes or outcomes, or if we're dramatically underperforming compared to what's been published, that helps us set priorities that are realistic and reasonable, as well as an understanding of our context. So both the contextual understanding and the evidence understanding help us to form priorities. And as a result of creating those priorities, then setting goals and benchmarks is also informed by evidence, especially if we're trying to benchmark or change on things that are widely addressed by other colleagues or other organizations. But one area where we didn't talk about evidence as much is analyzing our own successes. And this is a place where the gray literature comes in, where things that have been published and written outside of the standard scholarly trajectory of publication could also be relevant. These could be things like practice reports. They could be continuous quality improvement reports from similar healthcare organizations. They could be program output summaries from the not-for-profit world, or practice experience vignettes or narratives from popular media or magazines, newspapers. So other places that we can go to see what our colleagues are doing in similar areas. And so evidence from the gray literature, looking at practice exemplars, and non-peer-reviewed sources could be more relevant in areas such as policy, where there often is much less written in the scholarly literature, or working with not-for-profit organizations who are addressing unique situations or scenarios that might not be represented in the scientific literature. So collectively, when we look at this model for sustained transformation, gathering evidence using the evidence-based practice model helps us at all four of these crucial steps: at analyzing our own successes, customizing existing evidence, setting priorities and goals. Now, of course, this doesn't happen in isolation. We're not simply determining our successes by looking at what others do or defining our goals by what others have done, because there's a dynamic interplay between our context and our practice setting, where we hope to go as an organization, and what our other colleagues have written about and how they've been successful. So, as Melnick eloquently talks about, there is an interplay between clinician expertise, evidence, and patient preferences in the evidence-based practice framework. And that's also profoundly true when we think about the model for sustained transformation. We are not simply engaging in success analysis or goal setting by looking at scientific practice and evidence alone, but also looking internally at ourselves. So what we're doing in this week is we're talking about how to find the best evidence to answer the PICO question that we've created. And in the evidence-based practice model, you're searching first for documents and literature that synthesizes a wide range of evidence. It's more efficient, it's more effective to find synthesis documents that have already done the searching for you. And certainly you can search when there aren't syntheses that address your area of practice. You can go back to the primary literature by all means. But finding the synthesis first can reduce the time it takes to find and obtain the literature that you're looking for. So as we think about this process of searching for the best available evidence to answer our PICO question, what I'd like to do is go back to the PICO question we had proposed earlier in the term. It was focusing on HIV medication adherence in adolescents. So I've modified it slightly from our earlier version to be a bit more discrete and a bit more focused to guide our literature search. So we've said among HIV positive adolescents, which is our population of interest, how do 3 30-minute peer group-based motivational interviewing sessions that address ART adherence. So that's our intervention. We're going to try and target these adolescents coming back at follow-up visits and then bring them into a peer group with a skilled facilitator who could use motivational interviewing techniques to help them problem solve gaps in adherence and identify their concrete behavior changes to move toward increased adherence. So that was a proposed intervention. And then we were going to compare that to provider-initiated ART adherence messages, which is the standard of care, the standard of practice at present, which is where a provider identifies gaps in adherence. If they do, then they also have to create messaging and customize the message to that individual. We're trying to see then if doing group-based work that's more discrete and more focused on ART adherence, instead of diluting the intervention by depending on the provider to identify the problem and initiate adherence messaging, can we get at more effectively in this group technique? So that's our intervention, our comparison. And then the outcome we're going for is increased adherence to ART medicines over 4 months. So if the target intervention is to capture that adolescent on their first return to clinic, and then provide these 3 sessions, the 4-month period would be 1 month following the final motivational interviewing session. So here's that PICO question presented as a grid. And now let's take that PICO question and create a search strategy. So I'm going to use PubMed for the purposes of this demonstration, although in your own work, certainly use Melnick's guide about finding optimal databases that fit your particular practice context. So this PubMed is a strategic fit for this particular practice question. So what I'd like you to do is now launch launch a browser with the Emory Health Sciences library so we can link to free full-text articles. And as you have that browser launched, I'll demonstrate how to convert the PICO question into a search strategy. Then we'll look at how you create those search terms, and then how do you broaden and narrow your results to get the most strategic answer for your PICO. So here you see I've simply copied and pasted each element of the PICO into the search builder, the advanced search builder on PubMed. So each search field becomes one of the elements of the PICO. And now you can use your own clinical judgment and discernment and knowledge of the literature or the practice setting to see if maybe the language we use to express the PICO statement might need to be modified slightly to make the search more powerful. So I'm going to start here, provider-initiated ART adherence messages. I think that concept makes sense in the sentence form that we wrote, but in the literature, this is probably going to be gotten at a little bit more effectively by talking about counseling. So we're going to call it provider-initiated ART adherence counseling. And since ART is a very discrete element, and it has come up in another search term, I'm going to pull it out here to simplify. Now, if you look at this search, you probably will suspect that it's a little bit too cumbersome to generate many, if any, results at all. So let's run the search and see if we find any manuscripts that are going to help us answer our question. If we don't, then we come back to our search terms and see if we need to broaden them or narrow them based on how much literature we find. So let's run that search. So we got no items, which is what we thought might happen. So what you can do is go back into the advanced search, and your search history is going to be located below. So we can now copy the elements that are within the parentheses. Those were each of our search fields. And now we can modify them based on our own insight and practice knowledge to see if we can get more search results. So let's go ahead and copy and paste those and run that search again. So what do we think? Adolescent HIV positive patients. So patients could be somewhat redundant, so we'll take that out. And our second search term is probably what's giving us the most difficulty. It's a very complex concept of peer-based motivational interviewing sessions that focus on adherence. So instead of the complexity, let's go for simplicity. Let's just use motivational interviewing and take out sessions, since that's implied by motivational interviewing, and also take out what those sessions address. And provider-initiated adherence counseling, let's leave it simply as adherence counseling, since there might be many types of adherence counseling, but we're trying to broaden our search results since we got no hits on the first go-round. So let's run that search and see what we get. We have 4 results here. So now what you can do is you can go through these results and begin to look at the abstracts and the titles and see if there are any articles that fit your PICO question. However, as a starter, I'm going to go back and broaden the search even further since we only have 4 results. So let's go back to advanced and see how to increase it. So I've dramatically reduced the search. I've said HIV, motivational interviewing, and adherence. I've taken out adolescence, adherence counseling, the comparison. Let's see what we get. Now we have 61 articles. So you can begin to apply custom search criteria here on the left to narrow that down even further. So what you'll do this week is write your PICO question